Hey guys, just here real quick going over our calcium chloride stuff and how we're going to administer this stuff and go over a couple of things when it comes to the pump. So when we give this calcium chloride, this is in a 10 ml syringe. It's got 1 gram in it. So when you break that down, which we'll have to do later for when we talk about our pediatric administration, that is 100 milligrams of med in 1 ml. So just remember that. When we give this, if we give this in cardiac arrest, we give this whole thing as a slow IV push over about 1 to 2 minutes. All the other administrations that we're going to do it for either your hyperkalemia or your hemorrhagics patients are going to be this whole thing in a 100 ml bag over 10 minutes, which you'll just set on the pump. So with this thing, obviously, it's got going to have that lure lock right there at the top, and so you'll have to take just one of our needles, either a blunt needle or a sharp needle and that sort of stuff. Go ahead and attach it to this, and then make sure that we're putting it in the right port. And then you're going to go ahead and use your pump to go ahead and do this administration. The big thing that we want to go over when it comes to this stuff, though, is pediatric administration. For pediatrics, you are going to give them 20 milligrams per kilogram, and you're going to only push in what you need to give into this bag. So we're not going to push this whole thing into this bag. So we're going to decide how much we're going to need to give these patients, and we're going to just put that med into the bag. So if it's 20 milligrams per kilogram, say it's a 25 milligram patient, that's going to make the total amount of med I need is 500. 500 divided by 100 per mil is going to be, I need to push in 5 mils of this into my bag, and then we're going to do it. The big thing you're going to have to watch when it comes to this is when we do give this to pediatrics, is the pump forces you to do this kind of a special way. Hopefully you guys can see this. So you're going to do this, you're going to go do calcium, and it should come right up. Now here's the key here. So this is less than 50 or over 50. So even on the pediatrics, your max is going to be 1 gram. So if they're less than 50 kilograms, you're obviously going to click that, and it's going to tell you again the whole thing, 20 milligrams per kilogram in a 100 ml bag. Here's the big thing you got to watch. This is the amount. So this is not the amount of med. This is the amount of fluid that you're pushing. So like going back to my 25 kilogram patient, I'm going to be pushing 5 mils of this in there. So the total amount to be given is going to be 105. Oops. Clear amount. 105. And I'm going to hit OK to confirm that. And then from there, I'll be able to load the pump and do everything like normal. But just make sure that you remember that. Don't put how much of this med you're giving there. So it's not 5 mils, it's 105. So just make sure that you kind of watch that. And again, also too, this is going to be the same thing that you guys have to do when we do mag sulfate. If you ever have to push mag sulfate for a pediatric as well, you're only pushing in the amount of med needed into that bag, and therefore then into the pump. We don't put the whole 1 to 2 grams into the bag and then give it that way. So just make sure that we remember that.